thanks everyone for being here today. This is technically a follow-up from our first webinar that we did about cultivating change talk from, I think it was September actually, that we was our first one. So this is supposed to be a follow-up, but if this is your first time, you didn't get a chance to catch the other one, you can go to iread.org and rewatch it at another time. It's not a prerequisite. You can be participating in this and not have had to watch the other one. But we will get started for time's sake. It's going to be a pretty quick hour, at least I hope so. And this is kind of what we're looking at. In terms of objectives for the day. So we're going to do another quick overview of change talk in case you're not as familiar with it. And I do need to just point out real quick that for whatever reason, I don't know why, but for whatever reason, a lot of people believe that they're doing motivational interviewing and integrating their practices. And when you ask them about, well, talk to me about change talk, they're not really sure how to answer that question. But it's the kind of the crux of motivational interviewing, and the reason that's coming up is for me is because I just remember when my MI supervisor and mentor Kate Speck out of University of Nebraska came to visit me and deliver a training in Pittsburgh. She asked that question. Let's do a quick overview of what change talk is, and me and a group of about 20 other people, this was a handful of years ago, were like, we don't know what you're talking about. And she had to, take a step back and really coach us in helping us understand what change talk is so that we could move forward. So we are going to do a quick review of change talk, and then we're really going to be talking about specific strategies to elicit change talk. We're going to talk about using those strategies with intention and purpose, and then we're going to do a listening exercise where we're going to listen to a tape or watch a video rather, and during that exercise I would like you to identify, and we'll get to this later, but identify as you're listening to this, what strategies are you hearing, and can you tell what I'm trying to do with that strategy? And then lastly, we'll wrap up with what's next for you. Let's say you've attended a couple of trainings, you've experienced some webinars, you've read a book. How do you move yourself or your team of people maybe that you're working with to really deepen that skill set? Because unfortunately, reading books and attending trainings are only going to bring you so far. So we'll talk about what that looks like. So I cannot stress this enough. First and foremost, that motivational interviewing isn't motivational interviewing without a specific target behavior. That it really is about a behavior change. This is something that's been drilled into me from the very beginning, and pretty much any time I go to an advanced workshop, it's reiterated, is that we could be doing some really great reflective listening and asking some great questions. We might have this really open therapeutic relationship where we trust one another, but if we're not working towards a specific goal, with a specific target behavior, all we have is a really great relationship. That motivational interviewing is the act of addressing someone's, a target behavior that someone wants to address. So the next piece for us, change talk, again, is a fundamental component of MI. That if we're not working with the client to actively elicit change talk, that we're not doing MI. You're going to hear me say that 2 more times, and then I promise I'll stop saying it, but it's so important. When we're thinking about talking about advanced skills and this idea of cultivating change talk. And then just something for us to remember, that it's not common for clients, patients to come to us already expressing change talk. That when people present to us in any capacity, they kind of fall on this spectrum of change where maybe someone is expressing some change talk, and our job in that context is to really refine it, to elicit it more until someone's really at a place where they're ready to do something. On the other end of that spectrum is where someone's not expressing any change talk. They're borderline, for lack of a better term, obstinate, that they're not going to make a change. And for us, that changes our role and responsibility. We have to move to a place of just building that relationship until we have a relationship where we can start pointing out some discrepancies and things of that nature. So why does change talk matter? And again, we will review what change talk is in a few moments, but why does change talk matter? It's a predictor of behavior change. The research behind motivational interviewing, and this is why cultivating change talk is so important, tells us that the way a patient talks, the way a client talks, is a predictor of their behavior. So that if we can work with someone to get them to express a particular type of language, predicts a particular type of behavior. If you have someone who says, I'm not going to do anything, it's not important to me, this is garbage, I don't need to be here, well, we can kind of predict that that person's not going to do anything. So there's two types of change talk: preparatory change talk, mobilizing change talk. Again, we'll get to it later. But one is the foundation for the other, right? So that preparatory change talk is the foundation for mobilizing change talk. You need one before you go to the next. That'll be a little bit clear for you in a minute if you're not sure right now. And then again, I think this is the last time, you might hear it one more time, that without this intentional evoking of change talk, we're not doing MI. Cannot stress it enough. Part of why I'm saying this so much or often is that for a lot of MI is integrated into other interventions. And while I love SBIRT, which is screening, brief intervention, and referral to treatment, a lot of the brief interventions that are used in an SBIRT model integrate aspects of motivational interviewing. The brief negotiated intervention is a perfect example of this, where they teach you a couple of things like the change rulers and, exploring pros and cons. So the reason that I'm harping on this so much is that just because you're doing one strategy doesn't mean that you're really eliciting change talk. You're just using a strategy. What really makes these strategies work and motivational interviewing is that you're using them intentionally with purpose and intention. So again, it's difficult to pay attention to. I always equate this technical aspect of motivational interviewing as learning a new language, because what it asks me to do is to start conceptualizing and thinking about people and their behavior in a completely new way. I think it can be just as challenging for some people to really move themselves from a place where they historically understand and conceptualize people to a way of doing it with an MI lens, where you're paying attention to their language, understanding what that language means, and then developing a skill set in being able to navigate and shift someone's way of speaking about themselves and thinking about their problems. So change talk is a specific type of language that favors change, movement towards a change, a particular direction. And again, this stuff isn't new to a lot of you who are here, but again, it's important to review this stuff. So there's two types of change talk. There's preparatory change talk, and then there's mobilizing change talk. For most people, there needs to be an expression of preparatory change talk before they start to express mobilizing change talk. That when people are working with us, especially early on, we hear a lot of what we call sustained talk as the opposite of change talk. It's language that favors the status quo. So a part of our job is or responsibility if we're using motivational interviewing, is to move clients to start expressing language like, I really want to make a change. I wish I could do this. It would make a big impact in my life. Now that I'm thinking about making a change, I'm thinking that I could actually do a couple of small things, right? Eliciting that sense of ability. And then the reasons and need. I'm going to try not to spend too much time on it, though, and assume that everyone has a basic understanding of these things. And then lastly, preparatory change talk, and this is really important in terms of research. Preparatory change talk in itself does not predict behavior change. It's really important to remember that just because someone's telling us, I want to, it would make a big difference for me. That's not a predictor that they're actually going to do anything. We need to move people to a place where they're starting to express this mobilizing change talk, which is commitment language. It's them expressing, I'm going to do this, I'm ready for it, and then really talking about what that plan is for them. Another visual, and again, for those of you who attended the first session, this isn't unfamiliar to you. You've seen this before. I like to use this analogy, as do other people from the MINT organization, to kind of help explain this process. Because I like to think about when I'm working with a client that we're kind of at the bottom of this picture here, walking through this field or meadow, whatever you want to call it. And again, this is where it's really common as we're walking closer to this mountain to hear this sustained talk, this language that, again, favors the status quo. I don't want to do this. I don't think I can do this. Where you hear a little bit more of that discord or resistance. But as we get closer to that mountain, we're building that relationship, we're building that trust, people are starting to open up to us, and we finally get to the left side of that mountain at a base. And then our task is to move up this person, move up the mountain with this person, and supporting them and expressing preparatory change talk so that we can walk down the mountain to them, to mobilizing change talk, where we can really start planning with them and helping them elicit what they feel like is a plan that's going to work for them. Why is this important? Why is preparatory change talk and mobilizing change talk important? Again, because if we're not doing this specifically, what happens is we just have that relationship. A common phenomenon, again, just to quickly reiterate, is that we're walking through this meadow of sustained talk, really validating the person, maybe normalizing their experience, building this relationship. We get to the base of the mountain because we have that relationship, and then what happens is we just skip the mountain. Again, a common phenomenon for us is that we just jump right to planning. Someone says, you know what, this is a problem for me, change talk. But instead of exploring that change talk and really working to cultivate that change talk and bring them up the mountain, we just go straight to, all right, well, what do you want to do about it, right? That might work in a moment where someone's like, you know what, maybe I could do this or do that. And they come up with some ideas. But what we know is that the strength of change talk that we cultivate is a predictor of the strength of that behavior change. So that the more preparatory and more mobilizing change talk that we get, the more likely someone is to make a change. A common question that I often get is, well, how much change talk is enough before you go to planning? And the answer is, I don't have an answer. It really is just based on the circumstances, who the client, patient is. But in my experience of doing clinical work, and I'm a licensed professional counselor, I see clients on a regular basis, is that it comes natural, that it really isn't this thing where it feels forced. I'm not having to suggest, let's make a plan, that when I have someone expressing this preparatory change talk, that the mobilizing change talk tends to come naturally, as does the planning process. When we're starting to hear this mobilizing change talk kind of sprinkle into their preparatory change talk, that's a good indication for us that we're moving in the right direction and maybe getting closer to planning. So let's take a look at these strategies to elicit change talk. Now, for those of you who have a lot of experience in motivational interviewing, maybe you even train, maybe you practice it in different areas, we're going to look at strategies, but these are common strategies. You can go to Google and Google 10 strategies to elicit change talk. You'll get a list of 10 things. They're really good things. That's pretty much what the focus of the rest of today's workshop is on, are these specific strategies and how to use them intentionally. So let's start breaking them down a little bit. Just as a reminder, a loose definition of strategy is to carefully and intentionally implement a technique or method. When I supervise counselors, when I'm helping health coaches, dietitians, counselors, probation officers, whoever it might be, develop their skill set, oftentimes it's this piece of intentionality that they struggle with, is that they know the strategies, they can implement them, but they're almost doing them haphazardly. And we're gonna talk about that in a little bit as well. And again, as a rule of thumb, when I am supervising and working with people, when we listen back to tapes and these things, I like for them to be able to express to me what exactly they were hoping to accomplish or what they were hoping an impact to be, because that really moves us to a place where of more critical thinking and conceptualizing than before. So first strategy, ask evocative questions, questions that are going to evoke information in change talk, that are going to elicit that change talk. A couple of basic examples: how will making this change improve your life, and how does this behavior get in the way of your goals? Pretty straightforward. Ask for elaboration, right? So once change talk is expressed, we can ask them to talk more about it, right? A client says, I think making this change will make a big difference. Our response, what does the difference look like to you, right? It really gets them to talk about what that difference is. The more they talk about it, the more it becomes real for them. The more change talk they begin to express, the more they understand the problem, the more we understand the problem, and again, we create that dance of working together. Another common one is asking for examples. So once, again, change talk has been expressed, just to ask for examples. Well, this might be tough. I think I could do it. Well, give me an example of a time you overcame a tough obstacle, right? Or, really getting them to highlight specific instances or examples that they can use to their advantage. We'll talk about where you would use that in a little bit as well in conversation. Two of my favorites, looking forward or looking back. So if, in terms of looking forward, asking what may happen if things continue without a change, and then looking back to reflect on a time before the current behavior problem was present. There's a lot of different ways to tweak these to target a specific type of change talk, and again, we'll get to that shortly. A couple of examples. If you were completely successful in making a change, what would be different in your life? And then when you think about your life before you got involved in drugs, how are things different? A lot of these strategies, and again, if you're super new to MI, I apologize. Remember that when we're eliciting change talk, that when we're using these strategies, we already have a target behavior, and we already have a healthy working relationship. If I was going to ask someone who didn't want to make a change, if you're completely successful in making a change, what would be different in your life? They're going to look at me and be like, did you not just hear me? I'm not doing anything. Like, that's just what's going to happen. And for us, that's an indicator, right? Paying attention to their language, their body language, their engagement, for us to take a step back and really revisit the nature of the relationship and a couple of other things. And here are another examples of that looking forward or looking back. I just don't think it can get done. Well, imagine that 3 weeks from now, you've been successful in making this change. What steps did you take to make it happen? Or, I just don't think I can get it done. Tell me about a time in the past where you had to overcome blah, 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 right? We went through that. Query extremes is a really good one, and for whatever reason, again, member of Mint since 2014, I'm a counselor by trade. It's just one that I oftentimes forget about, and I don't know why, because it can be really impactful. That's one of the things that I love about motivational interviewing, is that there is no absolute one way of doing it, that you're going to find strategies that work really well for you and maybe some that you need more work on in practice. But the openness to be able to grow in your MI skill set and not say I know everything is really important in terms of continuing to develop proficiency and a level of expertise. So query extremes. Looking at the worst case scenario, if you don't make a change, what are the worst things that could happen? Or if you do make this change, what are the best things that might happen? So again, you can see there that that's going to elicit some type of change talk. The most common ones that people know about are the change rulers. A lot of people, for some reason, don't like the change rulers. I think maybe sometimes they just get too much attention in training, which can be off-putting sometimes. But when they're used intentionally and they're not overused, and I'll give an example then in a minute, they can be really impactful. What is irritating that I've found for clients, if you say, on a scale of 1 to 10, how important is it for you to make a change? You go through this routine, and then you say, well, on a scale of 1 to 10, how confident are you that you can do it? And then you say, all right, well, on a scale of 1 to 10, how ready? Like, it's just so repetitive and over. You know, I like to think that clients can only handle one change ruler in a session. There's so many other strategies and ways of cultivating change talk that they're not necessary all the time, but they can be a really nice visual for people as well. If you have something like this where you can print out, you can find that online as well. A note real quick about the change rulers. Again, it kind of walks you through, I don't like the word directions, but for lack of a better term, directions on the bottom, to ask these questions in this particular manner, because when you do it in this particular manner, you elicit more change talk while minimizing judgment or defensiveness from a client's patient. So I like to think that values and goals can be expressed, talked about pretty informally or generally in conversation. But you can also do something really formal like a values card sort. I think if you go to YouTube and Google something like values card sort MI, you'll have a couple of videos come up where you can watch someone do a values card sort. I do them with clients all the time because they really enjoy it. And it's really tough to actually express what your values are. If you go up to a random stranger who's not even thinking about behavior change and say, hey, what are the most important values to you? They kind of stop because it's hard sometimes to put specific words and language to what's most important to me. Values card sort, when they're done well, really help highlight what's important to a person and highlight oftentimes that discrepancy, that there's a big gap or discrepancy between what they identified as their most important values and what their behavior is. An example of this would be where, you know, like it says on the bottom, right? So a patient identifies their top 5 values as honesty, integrity, friendship, and something else. And they're dealing with stress and depression because they threw their friend under the bus to get a lower sentence, right? Like, just as an example of that discrepancy, right, that could be really problematic for someone or create a lot of strong symptoms. Again, it creates the foundation for people to have these conversations where they're starting to see that gap between what they're saying and what their behavior is. And then starting with the negative, it's not super tricky to pull off. I just don't often do it. I'm just not a funny person. It's just like humor. That's why I said that. It's just like humor. You have to be really good at it and know how to use it well. And it's not a humor ill-timed can have a really negative impact. Same thing with trying to side with the negative. It's as simple as over-exaggerating in a statement the status quo so that the person comes back and says, well, that's not necessarily true. And again, there's an example on the bottom. So you could say, you know, your alcohol plays such an important role in your life, you may never give it up regardless of the cost, right? I almost think of it as like a Hail Mary as well. It's kind of like a last shot in the dark. However, we should never really be at a place where we're having to throw a Hail Mary out there to try and move someone in the particular of change, but rather ground ourselves in the spirit of MI, in this notion of acceptance that if someone doesn't want to change and that's their choice, then that's okay. However, it can be done well and used effectively if you really know your client and if you have a really, really good relationship. If you don't have that relationship and you try this technique of siding with the negative, it oftentimes, again, creates that judgment or that defensiveness. So we are going to jump to, oh, no, we're not going to do that yet, are we? No, we're not. All right. So next we're going to talk about, we just reviewed 8 different strategies, and we're going to just briefly go over where we use those strategies, right? So all of those strategies aren't used haphazardly. We use them to identify or elicit a specific type of change talk. So let's break that change talk and these strategies down a little bit. So first and foremost, strategies that elicit desire, questions, elaborations, examples, looking back and forward, the importance ruler, exploring goals and values, and then coming alongside can be used to elicit the sense of desire that something, they want to do something. So someone says, for a patient might say, for example, I really want to make a change. The elaboration to elicit more desire would be, well, tell me more about that. Tell me how your life would be different if you did that, right? We'd be looking forward, et cetera. To elicit ability. Now notice that a lot of these strategies are used for the different types of change talk, but the language we use in our questions, the language that we use in our reflective statements are going to target this type of change talk, or a particular type of change talk. So we could ask an evocative question that targets ability. Might sound something like, well, when you think about your characteristics or skills that you have that could be useful here, what comes to mind? You're going to hear an example of this in a video shortly. You're going to hear me say what comes to mind a handful of times. It'll be really irritating for you, but it's fun. And then confidence ruler, right? Notice how we're using the rulers differently. Importance was to elicit desire, and now we're going to use this confidence ruler to elicit a sense of ability. Oops, sorry. And then let's go to reason. Again, notice the examples, these strategies. I like to think of querying extremes, which is one that we didn't see in the other two, as really effective at highlighting a reason. I want you to look forward and imagine that you haven't been able to make a change, or that would be looking forward. A querying extreme would be imagine that nothing changes. What's that like for you if nothing changes, down the road? Highlights the sense that there's a reason for them. We're really pointing out that there maybe is a reason or getting them to talk about that. And then I like to also think about it, using that exploring the goals and values to highlight a reason for something. And then strategies to elicit need. Why is this important? Because when we're working with a client, when we're working with a patient, it's not necessarily enough all the time to just get them to express desire. If I'm working with a patient and they're expressing to me a lot of desire, I really want to do this, it'd be really important to me, yada, yada, yada. What I recognize, again, I'm conceptualizing, I recognize I'm hearing a lot of desire, but what I'm not hearing is a sense of ability or reasons and need to do this. So what might move someone to that mobilizing change talk? Using strategies that specifically and intentionally try to elicit the other types of change talk that I'm not hearing. It's from there and using those strategies that hopefully we start to hear some of that mobilizing change talk. That oftentimes only comes when we're using strategies to kind of target all of those different areas of change talk. So what we're going to do now is I'm going to pull up a video. While I pull up this video, it's going to, your screen's going to go blank for a second, so just bear with me while I pull up the video. Don't think that you got kicked out or do anything like that, but just give me a minute. Before I pull up this video, though, I'd like to mention a couple of things. So I did this video the other day with a friend, and the context of this video isn't to show you proficient motivational interviewing. The context of this video was to see how many different strategies that I can try and use to intentionally elicit change talk. I think I got about 6 or 7 different ones in there. But what I'd like you to do, you have a task. While you watch this video, and you'll be able to see the time, I believe, what I want you to do is I want you to write down when you hear it, so at what time did you hear it, what strategy you heard, and then what you think I was trying to target. So if you heard me ask an evocative question 30 seconds into the video, what was it? And then what was I trying to do with it? Was I trying to elicit a sense of desire, ability, reason, or need? That really puts us in a position of really having to critically think about what it is that I'm doing and why I was doing it. Before we begin that process, does anyone have any questions? All right, I'm not seeing anything show up. So let me pull up this video, and then we will start. All right, if anyone doesn't have any questions, I think we're going to be good to go. All right, sorry about that, everyone. I promise you will have access to that video, though. The context, again, let me break that down for you a little bit. So the context of that video is that we started that conversation 15 minutes into it. So we skipped the first 15 minutes. I'm at a place where we've identified something, a target behavior that we want to work on, which is this idea that she wants to change her substance use a little bit, kind of like harm reduction a little bit. And I use those different strategies throughout. So when you have the slide deck online and the opportunity to go back and listen to it, you'll be able to see. At 30 seconds into it, I asked, we were going to break this down, an evocative question that asked about challenges, which is about highlighting a reason and need. So you can go back and see specifically, oh, this is what that sounds like. When I was learning motivational interviewing, one of the challenges was really figuring out, well, what does this sound like? It's easy to look at a sheet and see 10 different strategies to use. But what I found I was doing was using them exactly what I said is potentially problematic in a very haphazard way, where it's like, I guess I can use query extremes, or maybe this is a time to look forward and back. But it's really tough to know what that sounds like, why to use it. So what I encourage you all to do once this eventually gets posted is to go back to that video, to watch that video, and have these two slides next to you that you can pull up, where you can start to see, oh, at 10:35, he used the confidence ruler. At 12:30, he used another evocative question. At 13:30, another question. You can see that a lot of what I'm doing and did in this conversation, just by the what you see in front of you, I use a lot of examples. I asked a lot of open-ended questions that elicited more change talk, really moving her to a place where she said, I'm going to do something. I'm thinking this is what I want to do. Does anyone have any questions before we since we couldn't watch the video in this moment, before we finish this conversation and wrap up for the day, or go to our question and answer? All right, well, let's talk about deepening your skill set. As I said when we opened up, that attending a training, reading more material, watching videos will only bring you so far. They've actually studied this. So I always kind of chuckle in my head when I have a group of people or a person who says, I'm proficient in motivational interviewing. I know, they're very adamant, I know motivational interviewing. I can do it. I do it all the time. And I say, well, talk to me a little bit about your path to becoming proficient. Because I'm curious. I think some people can do things very naturally, and some people have a natural skill set. I just know what research says about getting there. So what I find is that most people attended a training, maybe read the book. And what I can tell you is that when I'm working with that person, as I'm supervising them, as we're working together, build that relationship, is they quickly realize, like, there's things, even if I'm doing okay, there's things that I'm not proficient at. And proficiency is really, really important. It's one of the reasons that I love motivational interviewing, is because we can say, if you're not doing proficient MI, that there's a good chance that you're not cultivating enough change talk, that maybe you're eliciting too much of that sustained talk while you're building that relationship, and that's going to impact a person's behavior change. So recommendations for all of you who are interested in developing your skill set, who are a part of an organization who wants to build a culture of motivational interviewing, is that really the only way to get there is through a process of supervision and coaching. It's what my mentor, Kate Speck, had done with me for so long, is listening to my tapes, being on the phone with me, providing me with feedback, and helping me to coach myself and using these strategies and advanced skills with purpose and intention. And pretty quickly, if you have a good grasp of MI, you start moving to that place of proficiency where it starts to become a more natural part of who you are, how you engage people, and how you move people along in their change process. There's a lot of people out there, likely in your area. The Mint organization is international, and I haven't met anyone part of the Mint organization who wasn't open to supporting people or a person, or at least helping you find someone who can help you. If you're an organization, training your supervisors how to code, how to supervise from an MI framework, developing your skill set, really, really important. On an individual basis, finding time to practice motivational interviewing, record it, send it to someone who can code it, give you feedback, and work with you. Those are the things that's going to deepen your skills in motivational interviewing. It can be a frustrating process sometimes, but as long as you're open and flexible, it tends to be a pretty rewarding process as well. So having said that, just remember a couple of things that it's nearly impossible. I forget his name. Dr. Campman from ASAM, American Society of Addiction Medicine, I think I once read, says there are no such thing as evidence-based interventions that don't have a therapeutic relationship, right? That without a therapeutic relationship, it's going to be impossible for us to elicit change talk. It is a requirement. It's the foundation of change talk. It's having a relationship where we have the openness and freedom with the people we're working with to really elicit that change talk, that we're not doing MI without a clear target behavior, and then to really think about, where are your skill sets at? Do you have a vested interest in developing your skill set? To reach out to someone, if not me, someone within your own area, go to the Mint website. Tons of resources, valuable resources. I think it's doable for pretty much everyone to bring themselves to a place where they are proficient, where they're more comfortable training, and so on. And I hope everyone, or encourage everyone to do so. So with that being said, if we want to open it up for a few minutes for some questions, if someone has any questions, I think that would be great. So one question about suggestions on videos, YouTube, or elsewhere. I mean, you can get free videos that are good and maybe even specific to your work environment. I know there's a ton of videos out there on YouTube that actually do a really nice job of showing you what skills being used and with what purpose. They tend to be more in the healthcare field, nutrition, diet, brief interventions, things of that nature, patient contacts. I personally recommend, and again, we can share this with you as well because I don't have the link on hand and I don't remember it. There's a DVD series that Stephen Rolnick put together that I just think is fantastic, that I think really, really does a great job of helping you explore and understand MI and in all of its wonder, for lack of a better phrase. I can't say there is a good or a bad videos out there like on hand, because there's so many of them. But to make sure that if you are using examples in videos, that they come from reliable sources. And for me, a reliable source is from the Mint organization, or specifically from people who have authored MI books, i.e. Steve Rolnick, Bill Miller, Alan Zuckoff, Chris Wagner, Karen Ingersoll, like all of these big people who have written extensively, done research, typically or commonly have videos that are pretty fantastic. Any other questions? Yes, yep, absolutely. And that question was, where can I find good YouTube videos to do MI? And that was that question. Anything else?
Alex, it looks like there's a few more that have come in. So the first one here was asked, when would times be that you would avoid MI?
When would be a time to avoid MI? I don't ever think you really need to avoid using MI, but I guess the response to that is to know exactly when you should use it. For me, whether I'm working with probations, working with counselors, we're always working to build this relationship of trust and honesty, where we get to a place where we can really start working with someone's behavior change. I guess the place to not use MI is when there's not a clear target behavior. That's the answer that comes to mind for me, is that if there's no clear target behavior, what am I eliciting, right? There's no change talk that I'm working to bring forth, because there's no behavior change that we're really looking at working with. And that would be one area where we're not going to use MI, when there's no clear target behavior, and when I don't have a really good relationship. I still might use MI, right, that idea of building that relationship. I'm just not going to start eliciting change talk yet until we're at a place where it's appropriate. Any other questions? It's hard for me to see on my screen, too. I apologize.
Sure, no problem. I can read off to you the stuff that's coming in.
Sure.
So there was another question that asked, kind of on the same page, what do you do with a response of, I don't know?
That's a really good question, and a really common thing. When I work with kids, I get I don't know a lot when I'm asking a lot of open-ended questions. And what that kind of communicates to me is that this person's not comfortable sharing whatever it is that they'd like to share. Or maybe I'm using language and questions that are either above their level or above their head, that they don't feel like they feel comfortable answering. When I work with kids and I get a lot of I don't knows, I tend to ask more direct questions. I tend to be a little bit less open-ended, where, I might say, well, how often, just as an example, instead of, well, tell me about your drinking, and they say, well, I don't know. I might say something like, how many days a week do you drink, right? And they say, 6, right? I now have something. They're answering that question. I can build off that. What brought you to 6? Was it always 6 or was it lower, right? And then we can build off that. But when I'm hearing a lot of those I don't knows, it typically comes from a place of they don't want to talk with me. If they don't want to talk with me, we're not at that place where we have that therapeutic relationship. We need to take a step back and really reevaluate, the strength of our working relationship. Do you want to read the next one, Jess?
Sure. So the next one is, how do you decide which skills to use?
It's a really fantastic question, and that's why I encourage you to practice all of the skills. Literally, practice all of the skills independently, and figure out what feels right for you. But the skill that I'm using more often than not, and I'm glad that you brought it up because I forgot, reflective listening. Reflective listening is the most complicated and most valuable skill. And with good reflective listening, you don't have to use a lot of these other skills that we went over today. However, what skill I use is really just about intent. The skill that I'm using is all about trying to elicit a particular type of change talk. So earlier I gave that example, when you have a client who's expressing maybe a need to do something but no desire. I need to go to this meeting, but I don't really want to. I might use one of those strategies and revisit the PowerPoint because I broke them down to say, okay, you need to, you're not at a place where you really want to, let's do that. Like maybe we'll use a change rule on a scale of 1 to 10. How important is it for you to do that, to be here, or to have them look forward, right? So it's really about understanding what type of change talk am I not hearing, and then inserting a skill intentionally that's going to target that. Jess, do you want to, any other ones?
Yep, sure. The next one is, I work in a facility using expert. Typically, patients are sustained pre-contemplative in regard to alcohol consumption. They do not typically have perceived risks. How could I help them in forward thinking? I feel at times it is easier to stay in the sustained talk with them.
It's kind of the challenge, like behavior change in general, the way that people move to do something new is not easy. And oftentimes, again, with these people, we do. I guess what I'll say is this: is that it's really important to validate and normalize and be with people and to express empathy, to connect with them, and that while disdain talk can be a barrier for change if we're listening too much of it, I also personally believe that it's a necessary evil. I think it's really important to get someone to really talk and express why something is really important to them and what role it plays in their life. But to really try and actively, again, work to move them to that place of eliciting or expressing change talk. Remember, and I said this earlier, we need to be at a place of acceptance as well, that not everyone that we're working with, and maybe we're working with a really challenging population, not everyone's going to be at a place where they are able or willing to make any changes, and being at a place of acceptance of that gives us the freedom to continue to work with them without feeling this pressure to make them do something that they're not ready or willing to do themselves. So it's a good question.
All right, we just have a couple more. The next one is, I work for a health insurance company that trains clinicians on MI. We are now looking to train our customer service reps in MI skills since they are in contact with patients. How useful do you think this might be, or how appropriate is it?
There's one of the best things about being a member of the Mint organization is that there's a closed forum where we have a lot of conversation, dialogue back and forth. You learn a lot from each other that way. And the conversation of the ethics of using motivational interviewing comes into play on a fairly regular basis. And there's an article written by Terry Moyers, the name escapes me, something about the relationship in MI. The name escapes me, but she quotes in this article that she writes, a really great article, the difference between MI and selling cars is that in MI you have the patient's best interest at heart. Right, that any time a company has a vested interest in a particular outcome, and that being a financial gain, that ethically it's not necessarily appropriate to be integrating or using motivational interviewing. However, it really depends on the context of what your organization does and a number of other factors. I'd say it's a conversation that needs to extend beyond what I can answer right now. But there are some ethical implications in using it in that capacity to really be thinking about, or again, reach out and we can talk about that more. Great question, though.
All right, one more. Any suggestions regarding resources for MI with complex individuals? So I think they're referring to like co-occurring disorders here and some mental health issues. Do you have any resources?
there are some resources that we can post. This is my personal preference. A lot of people would disagree with me. That's okay. Is that I think it's the healthiest way for me, and I feel like for others, to learn MI is to actually learn it in a very organic way without a specific population in mind. When you do that, it gives you the opportunity to make adjustments and adaptations to a specific population. But to learn MI in a very organic and natural way really opens up our understanding of MI across all spectrums. If you're already at that place and looking for specific training material and things like that, I would reach out to a member of Mint in your area and see specifically what they have to offer. Because I think if you're at a place already where you understand and know motivational interviewing, where the best type of work you're going to get in attention is with someone who specifically understands that population once you have that foundation in place. Anything else, Jess?
It looks like there's just one last one that we have. I'm often stuck with the MI guide metaphor. If we are truly following the patient, is it appropriate to have a direction we want to go in? What if that is not where the person wants to go?
It's a really fantastic question. The answer to that question is that they'll tell you, unless you're really intimidating and making people afraid, which hopefully you're not, people will tell you. That's what I like about this is that when I'm trying to move someone in a direction where they're not willing to go or they don't want to go, they tell you. They tell you by being defensive. That's where defense mechanisms come into play, is when someone feels like they're cornered, put into a box, they become defensive. And that presents itself in nonverbal gestures, in not fully engaging or passively going along with us. So I trust fully that if I think someone wants, or I have an idea in my mind that this might be healthy for this person, I'm also going to be transparent with them about that and say, it sounds like you're struggling with this. Is that something you want to work on? If they disagree with that and say, no, I don't want to work on this, then we can move forward. I think transparency and being honest and open with our clients that we're using is really, really important. The last thing I'll say about that is, when we talk about it today in this webinar, setting a focus. When you set a focus early on in a conversation, there's no guessing between you and the person that you're working with. To say early on, what you're talking about is X problem. Is that something that you want to work on? And having them agree to that, we now have fair game to, be navigating and guiding them through that conversation, rather than maybe passively bringing them to a place that they don't want to go. I found that setting that focus really helps counteract, that problem.
All right, awesome.
Great question.
Thank you, everybody, for all of your questions.